How you doing, Mr. Gordon?
Quinn, how's
so
it going?
good you came. Miss Gordon, you got him to come. How about that?
Yes, I did, but it was hard to get him to come. I had to just drag him out today.
But I keep telling her, I feel fine, so I really don't need to see anybody right now.
Well, I'll tell you what, Mr. Gordon and Miss Gordon. Can I share a story with you about a really good friend of mine?
Sure.
Okay. Mr. Gordon, it's really important for you to get your physical. And, you know, like your wife said, you haven't been here in a long time, and, you know, you say you feel good all the time, right?
Right.
Right. But look, I just want to tell y'all about a patient that was a dear friend to me. Still is a dear friend to me. He came by to visit just to check me out. And I convinced him and his wife to go ahead and get a physical. And they told me that he hadn't had a physical in over 10 years. He said he felt fine, just like you did. So we did the blood pressure, everything was good, no diabetes, all the blood work looked good. But then we got to the part about the male exam. You know, it's recommended that all men over the age of 40 get a prostate exam. Well, he didn't want it. That's fine. It's recommended to have that exam, but I reasoned with him. I said we could just do the blood, and if it comes back elevated, we'll go from there. And he agreed to it. It turns out his PSA, which is the prostate-specific antigen, was 8.5, and it's supposed to be less than 4. I referred him to a urologist. He had a simple procedure. He did have cancer, but it was diagnosed early. They did the procedure and told him to come back in a year. His life was saved. Now, had he have not gotten that physical, that cancer probably would have grown and grown and grown. And by the time he developed symptoms, such as blood in the urine or painful urination or other problems that go along with advanced prostate cancer, it probably would have been too late. So getting this physical today can possibly save your life as it did my friend. I'm glad you came, man.
Well, hearing the story you're saying now, I'm glad I came too.
Right. All right, well, let's go ahead and do it.
Okay.
Hey, man, we better than Tom Joyner. Moving on up. I'm trying to tell you. You know, you're right. You're right. Tom Joyner, how you be doing? Getting people to the doctor today? Getting people to come out to the doctor?
You're right. You're right. Because most men don't want to take that finger test. And so,
Well,
Dr.
let me
Quinn.
say that the bottom line is it's recommended that you do the digital rectal exam and the blood test. But for those out in the viewing audience, if you want to have a discussion with your physician about possibly doing the blood and getting the results back, like the gentleman we talked about, that's an option. Now it's recommended to do both, but the blood is better than nothing at all, and that's what happens for a lot of men. They don't go to the doctor because they don't want that test.
Well, Dr. Quinn, we appreciate you for doing this because helping get the awareness to where guys will come out to and go to the doctor.
Yeah, because we need to encourage men to go to the doctor a
Hey,
little bit more.
it can save a life.
Look, Doc, we here. You basically know we've been trying to lose weight for a while, but there's something about it. We just can't do it. I mean, it's almost becoming a fight in the house, man. Every time I say something about her, she gotta say something about my gut. You just.
And I'm not frying any foods. I refuse to fry. I don't like the grease smell in my house. And to help both of us, we just have to cut back on all the fried foods.
Well, let me just tell you this. The first thing about weight loss is it's not so much what you eat, but it's how you eat. And I've actually started this program, I say about 7 years ago. And Mr. Williams, you knew me back in college, man. I gained a little weight, now I've lost it, and I'm telling you this program works, okay? Now, basically, the way this program works is you don't necessarily eat more, you just eat in a different manner. You eat 5 times a day. 5 times a day. That's right.
It's expensive.
It is, but listen where I'm going with it, okay? Let's imagine the average person, okay? I go to my mom's house on Sundays at 2 o'clock. And I usually get a small plate with just a little bit of food. And everybody else there gets a big plate. And they're like, man, how do you eat such a small plate? Well, with the 5 meals a day program, let's say, for instance, somebody like my cousin, okay? She's trying to lose weight. She'll get the big plate. I say, when's the last time you ate? She'll say, 7 o'clock last night I had dinner. So Let's go from 7 o'clock at night to 7 o'clock in the morning. How many hours is that? That's 12 hours, right? Let's go to 12 noon. That's another 5. That's 17 hours. And once we hit 2 o'clock, you know, that's 19 hours. 3 things are going to happen. The first thing is your metabolism is going to automatically slow down. It's going to compensate, okay? So you're not going to burn fat very quickly. You're going to have a slow metabolism. The second thing that's going to happen is you're going to store more fat, okay? That's the great creator making it so you can survive, okay? The third thing that happens is when you do eat, you're starving. It's hard to be healthy when you're hungry. But me, on the other hand, I wake up on Sunday morning, maybe have a little oatmeal or, you know, something small around 8 o'clock, around 11 o'clock, maybe have a sandwich. So at 2 o'clock when I get to my mom's house, I'm not hungry, so I can make the better decision. It works. It works. Now, as far as what to eat, I mean, we just got to use common sense. Every time we get ready to eat, if it's unhealthy, we know it. We do. You know, and the one thing you got to do is you got to give up taste. Because that's the main thing.
Well, that's gonna be a problem, but it gotta taste good, man. I don't always see I eat tofu, eat like paper.
Well, I mean, you don't have to be an extremist, but the bottom line is just when you get ready to eat, make a decision, make the healthier choice, and you'll be successful. Now, as far as being expensive, it can actually be cheaper. Let's say I go to a restaurant where the people know me. I tell them to bring half of my food on the plate right now and the other half in a to-go plate when I get ready to leave. Now, if I go to a restaurant they don't know me, they say, this guy's crazy. So they'll tell me, I'll bring your food out, and at the end, I'll bring your to-go plate and you can box it up. That's not going to work. Do you know why?
Because you're going to sit there and eat.
I'm going to tear it. There's not going to be any food left. So what you have to do is you have to put yourself in a position where you don't have the food available. Like, don't go to buffets. I saw you at King Buffet. But the thing is, you have to set yourself up to win. And in your home, if you have chips and different things in the cabinet, you know, get rid of them. Get all that temptation out, and you can be successful.
So what kind of exercise do you think we should do? Should we do something on a daily basis?
Well,
Like,
as far as exercise goes, you just want to do something. Like if you're not doing anything, you don't want to get out there and run 10 miles on the first day. You want to work your way up. So I say start out walking, but try to walk fast, you know, push yourself, but listen to your body. You know, if you start having aches and pains, pull back a little bit. And also it's a good idea to go see your doctor and get a physical before you start exercise program for safety.
I appreciate it, man.
Hey, thank you.
Well, Dr. Quinn, as we were talking earlier, sometimes with weight loss and exercise, the combination of the two is more beneficial, isn't it?
Oh yeah, I mean, most definitely. And like we talked about, you know, with my dietary technique, you know, the 5 meals a day, you know, number 1, it speeds up the metabolism. Number 2, you store less fat. And number 3, when you eat, you're not starving, so you can make a healthier choice.
Okay. Well, we appreciate those weight loss tips, you know, because hey, it's working for me, as you can tell. You know what I'm saying? We appreciate you also for helping getting it out, getting the word out, okay?
Hey, thanks for having me.
All right. Back to the show.
Excuse me, ma'am.
yes, sir.
I'm here to pay my bill.
Okay, you're going to have to go down to the next window down there.
I don't want to go down there. My bill already too high. I'm here to pay a bill because y'all sending me all over the place. See how you just tried to send me down there? Y'all send me down there with 4. Look at him. There you go. That's the pretty doctor. Am I paying for this right here? Cause look, y'all can get a little smaller size of sanitizer. I'm telling you, sending me to the doctor. You remember me? Remember last week? Remember I was here.
I believe everybody remembers you. But look, here's the deal, man. This is what you gotta look at, all right? Sometimes, you know, let's say you drive a Porsche, right?
I do.
I know. We parked it right out front in the handicap parking
Baby
spot.
blue red.
But it's okay. But the bottom line is your Porsche is important to you.
That's my
And let's say you take it to a Midas mechanic. Now this Midas mechanic might be the best mechanic in town. I mean, he fixes Fords, Chevrolets, all these American cars, but a Porsche, he might say, hey man, I might need to send you to a Porsche mechanic because that mechanic specializes in Porsches. And the deal is your situation, you have a unique problem with your heart. And because I am a good primary care physician, I referred you to a cardiologist. It just so turns out when you went to the cardiologist, you needed an invasive study, so he had to send you to an invasive cardiologist. But at the end of the day, you got the best care.
What about the pharmacy though? I went there to get the medicine that they prescribed for me, and it was like $200.
Well, let me just say this. Now, what I will do for you, which I have done in the past, is I'll call your cardiologist and we'll discuss if we can convert you to a generic medication. Because in a lot of cases, you go to see specialists and they'll prescribe these brand medications, but they don't have the personal relationship that your primary care physician might have with you. So we'll see, but just know that brand medication is expensive. In some cases, you need it. Note that I am going to call the cardiologist to discuss it, but the best medicine in the world is no good if it's on the shelf. So we're going to work with you, but just know that the doctors, you know, we're not all in some cahoots or something. We're trying to give you the best care.
I can't stop looking into your eye, boy. What is this situation here?
Oh, man.
Oh, hey.
Talking about going to the doctor day. Yes. You know what I'm saying? You know how you go to many trips to the doctor. They go to the doctor and they say they're gonna send you this place and that place. You know what I'm talking about?
Yeah, I know what you're talking about. But thank you, Dr. Quinn, for making that clear. Because it's not gouging the doctor. It's not gouging to get sent to different
Well, that's
specialists.
just because you say that because you ain't had to pay for it. You know what I'm saying?
Well, the bottom line is we said, you know, the primary care physician, family doc, internist, pediatrician, they're the patient's, you know, best interest at heart. And sometimes the best interest would be to refer to a specialist so they can get the care that they really need.
Okay. And then also in terms of generic versus brand, you were talking about that.
Yeah, well, you know, sometimes, you know, the doctor will prescribe you brand medication, and there are times when the medicine is needed. But it's a discussion you should have with your doctor and just ask, say, are there any, you know, generic alternatives that would be equivalent? And in some cases, there are, but unless you let your doctor know that there's a problem buying this expensive medicine, you know, he'll never know that you need to even look into that.
Okay. Well, I tell you, we appreciate you for allowing us to come to take the trip to the doctor.
Well, thank you.
Speed. 3, 2, and 1.
Excuse me, ma'am.
Yes, sir.
I'm here to pay my bill.
Okay, you're gonna have to go down to the next window down there.
I don't want to go see it. That's what y'all messed up the first time. They got me going everywhere. I want to pay my bill right here with you right now.
I'm sorry, sir. I just make appointments.
They go the doctor right there with the pretty eyes. They, look, you helped me last week, doc. You don't remember me?
I do remember you.
Hey, look, you sent me to a doctor, to another doctor, and now I'm back here.
Well, the deal is you had a very unique problem. And when you go see a primary care doctor like myself, there are times when we have to refer you out to a specialist.
3, 2, and 1.
Hello?
Hi, how are you?
I'm doing well. Look, since you didn't ask, but look, last week, do you remember me?
I do.
You sent me away. You sent me to another doctor, man. Hey, I'm still in pain, by the way, but I'm back here.
I believe everybody remembers you. But look, here's the deal, man. This is what you gotta look at, all right? Sometimes, you know, let's say, hey, you drive a Porsche, right?
I do.
I know.